Today we're talking about melasma. Have you ever wondered why your skin looks like this, or like this? In this video, I'm going to help you understand what these patches are and why they are there. I'm also going to help you understand how you can prevent, treat, or maintain this condition. Studies have shown that this condition can lead to psychological problems like low self-esteem and sadness due to the appearance of this condition on the skin. Melasma is a medical term used for patches on the skin that are darker than a person's normal skin tone. It is actually a type of hyperpigmentation, and this condition typically affects women more than it does men because of the constant imbalance in the female hormonal world. Now, we're going to talk about the few causes of this condition called melasma. The first cause of this melasma is the malfunction of the melanocytes, which are skin cells that produce melanin in the body. Sometimes these melanocytes decide to go wild and then they overwork themselves by overproducing melanin. They produce so much melanin, much more than the skin actually needs. So when this happens, it can like store up on parts of the skin as patches or present as patches on the skin, on the forehead, on the cheeks, on the arm. Another cause of this condition, which is the most popular cause, is pregnancy. So this condition is very, very, very rampant. It's common amongst pregnant women. In fact, it affects between 15 to 50% of pregnant women. This condition is also called the mark of pregnancy. So the next reason why a person might have melasma is because of genetics. In some cases, melasma is hereditary. If you have a bloodline of people that always have melasma, it's possible that you also can develop melasma. In fact, up to 50% of people living or who have this melasma have the condition because of genetics, because it runs in their bloodline. Another very, very important cause of melasma is exposure to UV lights. So if you're constantly exposing yourself, your skin to, direct UV rays like UV rays from the sunlight, UV lamp, UV medical equipment, and all those UV beauty equipment as well, it's possible that you develop melasma because you're exposing your skin cells to UV rays, which is not really good for the skin. Another important cause of melasma is irritation from certain skincare products. So we're not going to pretend that we don't know that some of these skincare and beauty products can really get your melanocytes working overtime and overproducing melanin. That's why most times it's very good for you to use products with very serious active ingredients with caution and with care, and to use them with strong prescription. Like, don't just go using strong acids just because somebody somewhere said it. So now that we know some of the few reasons that melasma might show up on the skin, let's talk about how to treat melasma, how to prevent melasma, and then how to maintain it for people that it's hereditary for them. At that point, you have to just be maintaining it for the rest of your life. Over the counter medications, topical creams are usually prescribed or used. Let me not use the word prescribed, are usually used for melasma. So products containing active ingredients like hydroquinone, azelaic acid, kojic acid, and retinoid can help to maintain and care for this condition. So if you're going to be, buying an over the counter um topical cream just by yourself, not a prescription one, it is very advisable that you go for something with a very, very minimal, a decent percentage of hydroquinone. Don't go for something with a high percentage of hydroquinone so that you do not cause further damage to your skin. If you go for something with a decent amount of hydroquinone, it might help you to clear the dark patches on the skin on the long run, and make sure that you do not apply it on any other parts of your skin that does not have the dark patch. Just apply on the dark patches only. For pregnant women, most times melasma goes away on its own. Once you deliver your baby and your hormones are, getting back to normal, you will see that those patches will start to clear off by themselves. Most times you don't even need to, do too much if you have melasma due to pregnancy. So how can you prevent this condition, if you don't have it, how can you prevent it? Even if you have it, how can you like maintain it? The first thing that you can do or that you need to do to be able to maintain this condition or prevent it is to limit your sun exposure. Limit your sun exposure. You need to be very, very sun smart if you know that you're prone to having most UV related skin issues. You need to be very, very sun smart. So by being sun smart, I mean that when you want to go out, it's best that you don't even go out when the sun is very, very hot and when the UV rays are most strong, and this happens between, let's say, 11:30 or 12 in the afternoon through 3:34 in the afternoon. It's best that you don't expose yourself to direct ray of sunlight between this period. And if you do need to, expose yourself to the direct ray of sunlight, make sure that you have protective clothing on. Or the best way to be sun smart is to avoid the sun or use protective clothing like long sleeve clothes, hats, face cap, something that will just shield your skin from the direct exposure of the sunlight. Another way to treat this condition is to visit a dermatologist. Dermatologists have certain procedures that they use to help to treat certain skin issues, such as this melasma. So, they will help you to perform those procedures on your skin to help you feel better about yourself and your skin in general. Thanks for watching, and I'll see you in another video. Kindly give this video a thumbs up if you enjoyed watching it, and also subscribe to this channel if you want to join the family. And I'll see you in my next video. Stay jiggy.